context. I'm here today with Mark Cohen, the CFO from University of Rochester Medical Center. And we're here to talk about from very fragmented to fundable, how we are making AI finally stick. My name's Kelly Cantor. I am the Managing Director here at Innovaccer over the RCM Solutions. I have a background of about 25 years in revenue cycle management, product strategy, and a focus on artificial intelligence. I have a background heavily in revenue cycle, so I'm a credentialed coder as well as a certified revenue cycle representative. And Mark is, again, the CFO at the University of Rochester. He's a CPA. But Mark, why don't you tell us a little bit about yourself, your role, and the University of Rochester?
Sure. So I've been doing this a long time. I started out as a CPA. I transitioned from that, and Kelly made a joke at me of which topic to talk about, but I transitioned through chocolate making to consulting and implementing of accounting systems, which I did for about 12 years, both in my own company as well as at PricewaterhouseCoopers. And then I got into healthcare and worked my way up, and now I'm the Chief Financial Officer for the University of Rochester's faculty group. So I focus more on the provider side, the ambulatory side, and compensation. I do have an undergrad and master's from Bentley University, accounting undergrad and computer information systems graduate. Just a couple, I'll give you a few quick notes on Rochester. It's the home of Kodak, which if you haven't read the Harvard review of the Kodak company, I'd be surprised because almost everyone knows of Kodak, their rise and fall. Xerox, Bausch & Lomb, Paychex, and Wegmans. We are at this point, we're up to 8 hospitals, including home care, nursing homes, and the such. Rochester, we have 38,000 employees across the enterprise, 32,000 specifically in the clinical area, and as of yesterday's approval, our budget hits $8 billion. So it gives you an idea of the size of who we are. About 2,000 providers, actually 2,000 faculty, with another 800 advanced practice providers, so about 2,800 total.
That's quite the large health system. That's a lot of responsibility and probably a lot of innovation going on there. So as we're going to sit here and talk about this fragmented to fundable, obviously this context seminar that we're in today is really dominated by AI, and those conversations are dominating everything in healthcare right now. But from a CFO perspective, what is making AI more than just another technology trend for you?
So AI for me is a number of different things, right? So AI, as in the initial stages of AI, we really were talking more about reproductive activities, right? Taking the activity that was basically a click here, click there type procedure, and having it done automatically. And to today, where it's integrating thought in some way, shape, or form into the process that's being completed. So for me, it's looking at it in that spectrum and trying to figure out a way to make my employees stronger, right, and more efficient, and really improve their ability to be strategic, be thought leaders, as well as making decisions that are complex, and I couldn't have an AI do. That's where we see the value.
Interesting. And just, speaking of your thought leaders, et cetera, and, the context of what we're talking about today, from fragmented to fundable, when you think about fragmentation in healthcare, with your thought leaders sitting at the table with you, what are the biggest obstacles that you've seen preventing folks from actually successfully scaling their AI, even with that talent sitting at the table?
I think the biggest obstacle that we've seen is data, right? And in our environment, we have one hospital that's not on, we use Epic. We have one hospital that's not on Epic today. So from a process standpoint, they're not in a similar standard than everyone else. And as we brought people onto Epic, there's still, each department had the option to do things in certain ways, and it created a lack of standard even from within Epic. So when it comes to the data that's in the system, being able to use that data to automate things, you really need to work on that first. And that's probably the biggest limiting factor to getting AI to work the way you want it to.
That makes sense. And I think when we initially started talking, you were talking about your prior authorization journey, and how a lot of that automation exactly came from what you were talking about, which was very much, 10 different ways of physicians putting in orders, or I don't think it was exactly 10, but you had multiple ways of physicians putting orders in referrals.
We have an AI system for imaging, because imaging was doing everything the same way every time. And it made it easy. It made it easier to integrate an AI system into that. And we failed at implementing ortho, because I had providers writing orders on a piece of paper. I had them emailing. I had them entering into Epic. And the inconsistency made it hard to put a standard process around that.
That makes sense. And we do hear that, of course, healthcare systems folks are really investing heavily in AI. Would you say that that's probably one of the most foundational capabilities, is kind of streamlining those processes across all of the different organizations and making sure there is a process that's being followed? No matter what EHR you're on, it can still flow into the AI.
I think the simple answer is yes, and I'll throw some complexity into it. There are areas where AI is easier to implement than others. One of the things we're using is DAX for ambient listening. And the reality is it really doesn't need much from the Epic system. All it needs is to listen to the person speaking in the room, and it figures out how to format and put it into a note for someone to review and process. So solutions that are on their own are a little bit easier to implement than a solution that actually needs the data in the system to do something. So it's a little bit of both. But I would say without question, anything that's going to be process related, you need the standard data behind it to make it work.
Would you say that goes for the processes too? So not just the data kind of being governed and uniform, or as uniform as you could possibly get it, but also like the processes behind that data and how it's consumed.
I've seen some impressive AI solutions where the process really doesn't have to be wonderful, because the AI solution will watch what someone does, replicate the steps, and do it for them. It could be 2 steps or 10 steps in some way, shape, or form. So as long as the data's there, and the system can figure out where that person got the information from, the processes can be created. It's just a bunch of, and for the technical people in the room, it's just a bunch of if-then statements that really just need to be created properly and in the right order. So if you can figure out the order, the AI is pretty good at managing dumb processes as well as good ones.
I love that, the dumb processes as well as the good. Definitely having that context of, it's all about mapping the processes and understanding the processes. And, even you said if then statements, I almost think of it as decision trees that, if you get to a spot that you just kind of error out, then the AI will also error out.
Right.
So it makes total sense.
The ones that need to get sent back to the person, right? Yeah. Those are the ones where we actually need someone to take hold of it and figure out what to do next.
We can refer to that as human in the loop or edge cases. However, so many times in the industry, so many different ways. So let's pivot just slightly here. the University of Rochester Medical Center has actually invested in innovation through some really unique programs. You were talking to me about the health lab, and then you actually just came off of, like, a couple months ago, the employee hackathon. What
So
would
so there's three areas where we've invested that I don't know if they're different from others, but they're definitely unique in some way. We have a health lab. The health lab is basically an entrepreneurial environment for our faculty to work with technologists to build stuff. They do a lot of work from an AI standpoint to build solutions, but they also work with some vendors that we have a relationship with to help them enhance their systems, hopefully with a profit in the end in some form. So that's one area. We did have I learned that the name was actually buildathon, where we opened up our AI system to whoever wanted to. We provided training on how to use the system and build an app, and that 500 people actually joined in, learned how to use it, and build solutions. And we had awards for the top solutions, many of which were in revenue cycle. A lot of the solutions, and I liked the idea of it, a lot of the solutions were independent solutions, meaning it was something that you would put on your computer and run for you. And whether you shared it with your friend who did the same thing as you, it was like a little macro, but using AI to do something for you. And I thought of it as no different than creating sort of a macro in Excel or similar. It's just taking the AI tools that are out there and making your life easier. So I like the idea of it. Some of those we may expand and they may become enterprise solutions, but the ones I've seen so far were more like these 30 people need it, or these 10 people need it, and it's going to really help them. And then lastly, we've invested in an outside organization called Qualified Health, which they are both a builder of AI solutions, and a lot of academics have invested with the idea that whatever they build, everyone gets access to. But the other thing they're doing is they're being our data comp. So they're looking for those ghosts and the other issues that can pop up from an AI solution and really managing and administering them for us, creating that central solution versus having to do it ourselves, because that's costly.
Yeah, I can imagine that's one of the bigger costs, is figuring out how to scale it out and really make sure that it's going to work for everybody that is the intended end user. Speaking of that, though, as you do those different projects, what are those foundational capabilities that you find have to be in place? And also kind of what did these efforts teach you about generating AI ideas versus operationalizing AI at scale?
Well, it's always easier to come up with the idea than it is to operationalize it. I think over time, and I'm sure, and I'm not always good with the right terminology, but over time, AI solutions will fall into categories, right? They're going to fall into that independent solution versus the enterprise solution. There are some solutions that aren't that hard to build. And it's funny because I've got a team who will say, oh, we could build that in like 3 hours. And sometimes they can, and sometimes no, it's not realistic. But that's where the solutions sort of categorize themselves, right? We did some work with survey submissions that was based on our clinical data. And basically they built the AI to pull the clinical data out so that a nurse could review it, agree with it, and then submit it. It saved the nurse 30 minutes per case or something like that. But that's something that actually was quick. Now, to standardize it took more time, and to make sure that it was actually pulling the right data and validating and testing took some time, but the initial build was very quick. So it's a balance. And we'll see that. I think that's why when we talk about this being fragmented, you could see there's like 6, 7 different directions that even we're coming from in trying to build solutions.
Yeah, especially as you're trying to scale things out, and with vibe coding nowadays, you know, anybody can create something quickly that they can use. But like you said, you know, how do you get that to work for 300 nurses right now
Right.
at
Correct.
this exact moment? So yeah, that makes a ton of sense. Um, and auditing the AI, you know, when you think about as you build some of these things internally, how important is the governance piece or the oversight
Oh,
of
it's just as important as anything else, right? So this we have actually set up a governance team. It's about 12 people who meet on a regular basis to both discuss policy as well as to discuss new vendors that someone wants to bring in, right? And we've worked through some basic checklists of what the expectations are from a technology standpoint, from a from a data security standpoint. Is it using PHI or not? Is it cloud based or is it going to run within our system? I mean, all the basic questions you would ask of any solution, you're now taking it to the next level, and focusing on the AI specific questions you would have. We try not to slow things down, right? We still need to be able to move and purchase and make decisions and try new things. But we want to know what we're getting ourselves into, and at least make a reasonable decision as to what we're trying or not trying.
that that makes a ton of sense to me as somebody who's really into artificial intelligence governance and data governance. When you are sitting at that table with everyone, um, how do you decide whether the AI investment actually deserves that additional funding or not? I mean, from your lens, from a CFO lens, I know everybody has
So,
their own definition of it. So,
from a CFO lens, it's always the return on investment, right?
oh,
It's the value that you're going to receive from the solution. And I know we both obviously have that revenue cycle background. So from a revenue cycle standpoint, is it reducing my resource need? Is it reducing my denials? Is it increasing my payments? Right? Those are the things that I'm looking for to see how it's helping to streamline and improve the process that I've got going. In general, it's always looking for the value, whether it's financial or, and I'm close friends with the well-being director we have here, whether it's financial or just improve people's lives. Um, there needs to be the right value.
yeah, I see that. And I'm glad you brought up that value statement of, you know, sometimes it's not always monetary value. Sometimes it's the well-being of the patients.
Right.
Because that
Yep.
should be prioritized in healthcare as well. You know, as an industry in healthcare, we definitely have to have our eye on both sides. I mean, of course, you know, we have to make money, but at the core, we have to make people healthier too.
Yeah. I
So,
will say it also needs to be the well-being of the faculty or the
yep,
employees.
for sure.
Dax was a perfect example. When people started using that, the positive results that the CMIO got was incredible. People were so happy to have just saved whatever amount of time they could using that system. And financially, and he knew this before we started the rollout, I said, all they need to do is see one more patient a day. Um, so many have found that time and said, okay, I can handle that. That's not so bad. And it takes care of itself.
And when you rolled that out, did did you actually get the buy-in from the providers to begin with, or did you just kind of say, "Hey, this is what we're going to do. Try it. If you don't like it, you don't have to see that extra patient a day."
So we piloted it with a small group. I'm going to guess I think it was somewhere in the range of 50 to 75 people, of which many of them were already what I would define as drinking the Kool-Aid. So they were people who were more integrated into the organization. They were people who were more tech friendly. Um, and the reality was we used them to develop some data around what they were saving. We looked at their I think it was called sort of their sleep time use of Epic, where we would look at the chart of when they were connected into Epic from morning to night, and you could see how they were reducing that time after dinner that that they were usually in the system to do their notes.
Right, right.
So we created an environment where we could prove to the next 75 people that it actually was working. And then once people started using it, and we gave them the option, we didn't force it. We also didn't force them to add visits in the beginning. We talked about it and we suggested it, but we didn't force anything. It made it easier, and over time we've seen the benefit. I mean, both from a well-being standpoint as well as from a financial standpoint.
And of course, it's their finances as well. You kind of nudge them into that one
Their
extra pay.
finances as well. Yeah, we've had that conversation as well. Yeah.
Yeah, for sure.
They get paid more too.
As we think through this, and I know like ambient listening and note generation is just one aspect, but it seems to be a pretty big aspect. But as you are thinking of some of those tools that are out there that more or less really rely more on that data coming out of the EHR or out of the clinical systems or your PAC systems, do you really, and as you acquire more AI tools or just more AI solutions, because you guys seem to be building out a lot on your own, are you spending more time fixing your data infrastructure? I heard about the fragmentation. What are you doing there?
I would say every time we implement something, whether it's AI or not, we're fixing the fragmentation. With AI, it needs to be done more, but we're always fixing something. Because, and I think there was a comment we had talked about, there's really not perfect clinical data. It always has problems. So we're always fixing something, and we make it as best we can and then work with it. So yeah, I think that will always be a thing.
Are you seeing where the investment in the data infrastructure is almost as important, if not more important, than the investment in the actual AI technology solutions?
Oh, so it's an interesting question. I know my immediate response to that question is yes, but the reality is no. The reality is that both are just important, right? You need to be able to get the data into the system, but you also need to be able to get the data out of the system and have it be usable. And it is interesting, a little bit of a historical trail I'll go on. When I implemented accounting systems, I worked in the middle market. So they were systems that gave you one choice of how to do something. Where you get into Epic, you have like 10 choices sometimes on how to do something. And that's where the data really becomes more important, because those choices are complex. And to make those complexities work, you need good data. It's a little bit easier when you're working in one basic thing. But to really use the system and get the power, you need the data to work. But you also need it to be usable for the different people. So you need to create those different views, the different options. And that's where AI is going to make it easier in the future.
That makes sense. Kind of bringing it all together and distributing it. All together,
right?
How the different personas consume it. That makes sense.
When you think about the coding augmentation, it's bringing the policies and the medical necessity and the documents and everything else into one view for someone to choose. Those are coming from all these different places, and it's putting it in a way that someone can actually use it quickly and be efficient.
Yeah, I've actually worked with data scientists in the past that when they actually sat with like a denials coordinator, they were amazed at how many different systems this person had to go into to just navigate the maze of where does this even belong and who do I need to send to in the next step. Be able to conglomerate all that together and surface those insights immediately is huge. It's a game changer, and especially from the bottom line. It accelerates the cash as well as, makes your people faster.
Yes, and happy in some ways. 50-50. They may not always be happier, but they might be paid better.
Sometimes it's about being happier at work, if possible.
Have to think harder, but they will get likely paid better.
Right, and that's very true, because that comes back to the human in the loop, because the human in the loop now is having to do things, work at the top of their credential or the top of their license, kind of got all the fluff away from them. So they're not just kind of clicking through and saying, oh, this routine one, I can do 15 of these an hour. It's more like, oh, I have to spend some time actually researching this. Uh, so that's always good. Back to the fragmentation, and I know when we talked, you talked about having so many different specialty-based tax IDs across your organization, and that added this complex layer that was just hiding in the data that you guys didn't really anticipate running into until it started bumping its head up. So, what are some additional operational realities that seem to create some significant barriers in that space that, again, just kind of pop up out of the blue for you?
So if you think about, and this is a very generic thought process, but when you think about customizations or things that you've created, the tax IDs is a perfect example. Over time, we took a bunch of disparate departments and brought them together into the University of Rochester. So as they came together, we chose not to bring them into one tax ID, which had benefits, and it created a complexity. Right. So we have to do certain things custom to make that work properly. When you think about, and we're a large organization, so we do this to ourselves all the time. We do this to ourselves often. So when you think about something like self-pay and cosmetics and setting prices on something, having a standard model to that and creating a standard structure within the system is going to be better than letting each provider choose their own pricing, because it makes things harder to manage. It makes things harder to replicate or automate, however you want to look at it. So it's really, when you think about what you're doing and what you're allowing someone to do, anytime you create custom in some form, you're going to add complexity to the next time, right? You're going to add complexity to an upgrade. You're going to add complexity to a report. Those aren't always bad things. You could make a lot of money off of complexity because you need to, right? But you also need to be aware of what you've created and make sure you can administer it over time.
That's a great perspective, because I mean, even if you think about what we create with the data today, is it going to translate to whatever the technology is going to be in 5 years? And that's a hard question, because I mean, who saw 5 years ago where we'd be today?
Right.
Technology is just getting more and more impressive, and just it's compounding on itself now. So let's talk about rev cycle specifically. When we think about functions like patient access, prior auth, denials, which we touched on a little bit, coding, where do you think, or where are you seeing health systems are seeing the greatest financial impact, and could potentially see another side of it even jump even higher over the next few years as AI gets better?
So I'll go with the 10 years first, because that's how I like to think of it that way. Today, I still have a problem with how voice recognition and I'll use the Epic side of things, the Epics and the Pennies of the world work. I find that technology is getting better and better, but I still feel like I'm talking to a child at times. Right. So there's a lot of value in that functionality to be able to collect the right information, validate it, ask questions about it. You could use a simple example like eligibility, right? If I've got someone that's calling in and I need to get their insurance, at the same time, I can be running a real-time eligibility, and I don't even need to be a person. It can just be a computer talking to this person, but they need to be able to talk in a way that's acceptable, and it's not there yet. I think as that grows and gets stronger, it could take over a lot of roles. And I just think it needs time. So that's sort of my 5-10 year scenario, and it's probably not 5-10 years. It's probably 3 to 4 years. Today, it's, to me, I focus on the front more than I do the back end, right? It's getting the right information from the front end of revenue cycle, the insurance, the coding, the authorizations, etc., making sure we've got that right so that the back end has less to do, right? If we get the right information up front, then our denials are going to be less, our cash is going to come in quicker, and we're going to be focused on the big problems more than we are the little problems on the back end. So that's where my mind focuses. But from a system standpoint, we're working in all areas. We have to, because we need to solve the today problems as we're working towards the tomorrow ones.
Right. And just thinking of the rev cycle, the front, middle, back piece,
Yeah.
have you all started leaning into using the back end or those denials that are coming in to start kind of training some of those AI solutions up front and getting ahead of that, whether it be for the human or whether it be an actual agent or module that you're out front?
I would say we're an Epic first shop, so we use Epic when we can for solutions. But without question, we're using the data from the back end denials to decide where we're focusing.
Okay.
And I think most entities are going to be in a similar boat. Our biggest areas of focus right now are eligibility and prior authorization. Those are where we have our biggest denials. So those are where we're starting. There's a lot of systems out there. So it's finding the right system, but it's also, it's an interesting dynamic, right? For me, I happen to be a glass half full person. So I also tend to trust quickly. Getting someone to trust the AI solution that it's doing a better job than you are is not easy. It takes time and effort and practice, and they need to understand that they will still have a job for it's doing something. But that has been a blockade at times for us. Getting the person to accept the information and just letting it flow is as hard as anything else when it comes to implementation.
Oh yeah, I hear you on that. End user adoption and change management, two of the big things that a lot of people
Right.
don't talk about when they talk about rolling these types of things out. So when we are talking about the AI and RCM, what are you monitoring to show that things are actually improving versus it just, speeding things up faster? Like, I've had these conversations with folks where they're like, well, we implemented this, we didn't see a reduction in denials. It's kind of like we implemented a faster calculator.
So some of them are just faster calculators. Um, so one of the things we implemented was a prior auth solution for imaging, as I mentioned. In that solution, our biggest problem was Epic wasn't tracking it before. So we really didn't have any good data on how bad we were prior to putting the system in. But once we got the system, we can see, I can track how many they're doing on a daily basis by user, how many edits are happening, how many times the system is doing it for us so we don't have to do it. And you can see, and that's all efficiency, but we can also see our growth in denials on a monthly basis compared to our growth in revenue. And we track all of that. We probably track it quarterly or twice a year just to make sure it's still moving in the right direction, unless we see a red flag in the financials, which we haven't. We also haven't seen a red flag in the team. The team's been happier, and the team hasn't had to grow since we implemented that system. So there's some obvious positives that we've seen, but there's also some specific data we can look at to really understand where we've seen the benefit. Have we seen every benefit someone told us we were going to? No. We also didn't believe that up front, but we knew we needed to do something because our volume was overtaking our people. And at some point, you got to do something to keep the team at a manageable size.
That makes sense. And have you seen or had a better visibility into payer behavior around prior auths doing that?
No,
I know that's
I would say, so it's interesting. I would say a little bit, but not a lot. The reality is we've made it better for them, right? We're providing standard data. We're providing it electronically. We're using the integrations that they've made at least somewhat possible so that the data gets to them quicker. They're responding the same way they did before. They're just responding a little bit quicker because we're getting it to them in a better format. So I don't know if they're really doing anything better. They're just getting better data to work with.
Yeah, and I've heard it when we start talking about prior auths or denials or appeals or anything like that and using AI out in the industry. I hear a lot of fighting fire with fire. You know, they have AI,
Yeah,
we have
no,
AI,
understood.
the two models fighting with each other. So, all right, well, it looks like we are getting close to our time. So one last question for you. And what's the first investment, if you're talking to CFOs in the room, what's the first investment you'd make to take an organization from fragmented to fundable?
I would find someone who's an expert. And there's a number of companies out there that will do it, whether you think they're good or not. They do a pretty good job. And let them give you a pathway to go. So use an outside consultant. Let the advisor advise. You don't have to choose them to do something in the future, but let them advise you as to where they think the best thing for you would be, because you may not see it.
Okay, I like that. Okay, I think we're opening up for questions. This one's for you, Mark.
Oh, it's a good question. Okay, so I guess the simple answer is I do, as well as the chief operating officer. If I think about it from the medical faculty group standpoint, if the AI is underperforming, without question, we're going to take responsibility, as is in some ways ISD. From a departmental standpoint, a lot of these are done enterprise wide or started at the enterprise level. But yeah. When you say accountability ever actually been tested at Rochester, yeah, I mean, I think of it, we test it on a regular basis. We did the pilots we do, the solutions we create, the budgets we create. We're always pushing back on people if they're not hitting it. So we're definitely holding people accountable to what they're doing. We may accept a lower level than they said they would have in the first place, but without question, we meet on a regular basis with every division and department and hold them accountable to what they've said they could do. So, but in the end, I always say I'm responsible. I gave someone the okay.
That's the C-suite curse and blessing. I'll go ahead and let you take that one.
It depends on what you're trying to do. I would say that good enough is always good enough to start. It may sound, I'm going to always push on better data, stronger data, more consistent data, but you always can find somewhere to start. There's always something in the data that might be okay. So if you need to do something, good enough is right now.
Let's see if there's any others coming through.
While he's working on the question, the other thing I would note is that if you choose good enough right now, just remember your ROI might be a little bit different, and take that into account.
That's a fair point, because I'm not going to use the cliche that's out there about what goes in comes out, but right. I mean, the truth of the matter. You get what you put in. You get out what you put in.
What are the top two categories? Sorry, of patient data.
Oh, you're good.
I have to think about that. Top two categories of patient data that create the greatest financial predictability in your revenue cycle. So from my point of view, it's interesting. I'm the CFO of an organization that generates probably close to $700 million just in ambulatory revenue. I'm focusing at a very high level. So I am looking at my daily charges and my daily payments to see if I see any red flags that I can ask my director of the professional billing about. So at my level, that's where I'm starting, right? When she's looking at it, she's taking it to the next level and looking at everything from work queue volume to denials and write-offs. So I would say it really depends on the level of the individual. But for me, it's the basics. It's charges out the door and payments coming in.
I think that puts us right at time, or we might have time for one more. And if not, it's been an absolute pleasure having this conversation with you, Mark. It's been great meeting you. Thank you for your time, and just thank you for everything you're bringing to healthcare and moving it forward.
I appreciate it, and happy to have the discussion. And I think it's a good one for everyone to think about. I don't always have the right thoughts, but I have thoughts that challenge people. So hopefully it challenged someone today.
That's what the intention is to make sure people are starting to think through more than what's on the surface. So, all right. Thank you all for attending Context. Have a great rest.